Have you been putting off or delaying to seek medical treatment for your varicose vein problem? Then this topic is for you. It is very tempting to think that leg swelling, night cramps, tired legs with achy pain will eventually go away and that they will get better on their own. Hi, I'm Dr. Mina Manikis. I am board certified in dermatology and cosmetic surgery. Just call me Doc Mina. Hi gorgeous viewers. I have two previous blogs on varicose veins. Please watch them for you to better understand my topic for today, which is sclerotherapy. It is the gold standard treatment for varicose veins, and it is a non-surgical form of treatment where a doctor injects medicine into the blood vessel. This medicine is called sclerosant, causing shrinkage of vein leading to scar formation. This will force the blood to reroute to healthier veins. In around 3 to 12 weeks, the collapsed vein is reabsorbed into local tissue and eventually fades in weeks to months. This is not a single session treatment and may require several treatments depending on the severity of the varicose veins. What do you expect during the procedure? You lie on your back with legs slightly elevated. The areas to be treated are cleansed with alcohol and using a very fine needle to inject the sclerosant. After the injection, compressed pads are placed on injection site to keep blood out of injected vessels while moving on to the next vein. As I have said earlier, this may require several treatments. What are the side effects of sclerotherapy? Bruising, small skin sores, raised red area, darkened skin, multiple tiny red blood vessels. There are two types of sclerotherapy: liquid and foam sclerotherapy. What is the difference between liquid and foam sclerotherapy? Liquid sclerotherapy mixes the sclerosant with the blood and thus dilutes the sclerosant. In foam sclerotherapy, the foam displaces the blood, allowing direct contact of the sclerosant with the endothelium. Thus, efficacy is increased. There is 4 to 5 times increase in volume as compared to liquid sclerotherapy. So you need a smaller total dose of the sclerosant. Foam is washed away less rapidly due to increased viscosity. Extravasated foam, that is outside of the vein, is better tolerated than liquid. Foam is safe and effective, superior over liquid in eliminating sites of reflux along great saphenous vein due to viscosity. The Tessari method is being used in foam sclerotherapy, wherein air is mixed with the sclerosing agent. The usual sclerosing agent being used is polidocanol or STS, sodium tetradecyl sulfate. It is done using 2 disposable syringes, one with air and another syringe of liquid sclerosant using a 3-way stopcock valve. This is turned 30 to 45 degrees to make foam bubbles as small as possible, producing high-quality microfoam. This is mixed vigorously 20 times back and forth until you get a consistency of a shaving cream. The ratio of air or gas volume to liquid sclerosant is an important variable. There are two forms: wet foam versus dry foam. Wet foam uses 3 ml of gas to 1 ml of sclerosant, while dry foam is 6 ml gas to 1 ml of sclerosant. I am using the wet foam technique. The foam should be used within 60 to 90 seconds or 1.5 minutes. When you do the procedure, keep needle flat to the skin and aim superficially, allowing the solution to come in contact with the entire vein wall. Notice the blanching due to the replacement of blood with sclerosant, usually with less than 0.5 ml. Stop when bleb appears. Thus, less solution is needed to get optimum result because this mixture of air and the solution goes a long way. This is more useful for longer and larger vein and gives a burning feeling followed by itchy feeling which goes away after a few minutes. Limit the total volume of foam to 2 to 4 ml per side, using a total of 10 ml per session. After sclerofoam, you elevate for 5 to 10 minutes more to allow foam to liquefy as much as possible to dilute the sclerosant and prevent early proximal movement. Wear compression stockings immediately to improve the outcome with decreased pigmentation. Use the compressed stockings for 1 week, except in bath. 2 daily walks in the first week, and there should be no rigorous lower body exercise. Complications of sclerotherapy. Deep vein thrombosis. This is low risk but increases in large diameter vein and when the sclerofoam volume is over 10 ml per session. So don't use more than 10 ml. 2. Superficial thrombophlebitis. This is treated with compression or microphlebectomy to trap blood or intravascular hematoma at the site of foam injection. These are hard tender veins in a recently treated area. Drain around 2 to 3 weeks with large caliber 18 gauge needle and pressure to reduce the pain. 3. Hyperpigmentation. 20% of sessions will have brown discoloration due to hemosiderin deposit. Most resolve spontaneously within several months to 1 year. If there is no resolution, you can use intense pulse light or bleaching agents. 4. Matting. These are tiny round vessels around site of injection due to neovascularization phenomenon. This is seen in 15 to 20% of sessions. If this is persistent, use intense pulse light or surface laser. Skin necrosis from extravasation of sclerosant at higher concentration or injection in skin arteriole. Other treatment options to prevent varicose veins from getting worse. Invest in a good medical compression stockings. This is a mainstay for symptomatic varicose veins. These provide gentle pressure and reduce tiredness. It also improves the circulation to help prevent pooling of blood. These should be worn 2 to 6 weeks post-sclerotherapy. This is tightest at the foot, and it is not harmful to wear longer hours but not necessary to wear 24 hours a day. 20 to 30 millimeter mercury is often the start for varicose veins, but if it is severe, 30 to 40 millimeter mercury can be used. A lower compression can be applied for mild lymph edema or generalized leg edema. There is no reason to wear the compression stockings when sleeping because when you lie down, you take away the effect of gravity. It may become a cause of blood clot if the compression stockings are fitted incorrectly, either too small, rolled, or folded over, which may cause skin irritation. You wear the compression stocking best in the morning when limbs are least swollen. It takes 6 weeks to see result, and you should have at least 2 pairs to allow washing and drying of the other pair. You can just use the compression stocking for one leg or 2 legs as needed or indicated. Compression stocking should feel snug but not painfully tight. It should have a firmer fit to prevent deep vein thrombosis. To remove, fold it down until it gets stuck up in the ankle. Use thumb to horn it down to slide off the foot. How to wear compression stockings. You put toes in toe of the stocking, gently roll and slide back over the heel, then fingertips or palm to slide up your leg. Don't grab or pull at the top of the stockings, otherwise you'll rip or tear it. You can wear it every day but wash every day for hygiene and to preserve the life of the stockings. Increased pressure in tissues beneath the skin is accomplished when you wear compression stockings. What is the difference between support stocking and compression stockings? In support stockings, you have passive resistance to swelling, while in compression stockings, you apply active pressure on leg veins. Avoid prolonged standing or sitting. Elevate the legs. Exercise the legs. Leg muscle are our greatest allies, so you strengthen them by walking, swimming, or biking. These are very low impact workout, causing no jarring or pounding of legs. These are simple movement but strengthens calf muscle without straining your body and helps vein move blood along. Massage treatment. Vascular and lymphatic drainage massage can increase circulation and improve tissue nutrition. Short strokes are used to move blood from the valves to the veins. Don't wear tight-fitting clothes, especially those constricting in the groins, waist area, or thighs. Stay hydrated. Drink lots of water. Dehydration causes tissues to swell and muscles to cramp if with varicose veins, leading to aching and soreness. Lose weight. Observe a healthy diet. These are the foods that you can avoid: refined carbohydrates, added sugar, alcohol, canned foods, and salty foods. When you sleep, sleep on the left side because the body's largest vein, the vena cava, is on the right side. Caffeine can constrict blood vessel and elevate blood pressure, which may lead to increased strain on the veins. Vitamin B6 and vitamin B12 remove homocysteine, an amino acid that is linked with clotting problems. You take vitamin B6 and vitamin B12, especially if you have a family history of blood clots. So these vitamins help with blood circulation and lowering cholesterol. Vitamin C and E are antioxidants. Vitamin E has anti-inflammatory effect in vein linings and thins the blood by preventing platelets by sticking together. Niacin or B3 are best agents to raise blood levels of high-density lipoprotein which help remove cholesterol deposit. Smoking harms the walls of the blood vessels, so avoid smoking. That is it, mga kaderma at mga kabalat. Give a thumbs up if you find this blog informative and useful. Bye for now. See you around for more skincare and wellness tips. Take care of our health, guys. Mwah.